السلام عليكم طلابنا الأعزاء. عبير عدنان نوري, Dental Technician, Master Postgraduate Student, College of Health and Medical Technology. I will explain the seminar of fixed full arch mandible and maxillary implant supported prosthesis design and fabrication. Part 1, supervisor by Dr. Zaja Ali Mohsen. I will beginning Bismillah ar-Rahman ar-Rahim. Introduction. Implant-supported fixed restoration can serve as an excellent treatment modality for a dangerous patient. The implant fixed restoration have psychological advantage compared with the overdenture prosthesis. Whereas an overdenture is a prosthesis, a fixed restoration is considered body part. Advantage of fixed full arch maxillary prosthesis feels speaking more naturality with greater confidence, help prevent further loss of ridge, look will function and feel like natural teeth. Recent dangerous patients prefer fixed teeth, psychological advantage of the permanent teeth, less crown, high space required for restoration, replacing partial plates and may be used to secure loose dentures, less food impaction, كذلك high implant survival rate. Methods fabrication of fixed full arch maxillary prosthesis. عندنا طريقتين حتى نسوي الفابريكيشن of the fixed arch maxillary prosthesis. عندنا الدايركت method with CAD/CAM technology والindirect method. الدايركت method تتضمن 3 appointment. الindirect method تتكون أكثر من 3 appointment. First appointment بالنسبة للdirect method تتضمن appointment selection, preparation of appointment, impression, occlusal vertical dimension record, centric bite registration, كذلك transition restoration. Second appointment تتضمن metal try-in or acrylic try-in. Third appointment تتضمن final delivery. Step by step fabrication. بالبداية راح نسوي selection للاباتمنت اللي هو the straight abutment for cement retention are threaded into the implant body. Vacuum form of the maxillary denture is used to evaluate the abutment position. الvacuum form راح نحصل عليه من البايوستار device. راح نستخدم thermoplastic sheet ونستخدم الماكسيلاري denture of the patient ونسوي عليه adaptation ونحصل على الvacuum form. The abutment are prepared in the mouth for parallelism with the high speed handpiece and carbide drills. وراح نستخدم الفوتوغراف mirror to evaluate the abutment parallelism. In first figure, we notice the abutment screw hole are sealed with the light-cure material to prevent the impression material to enter the hole of the abutment screw. Mesh occlusal analysis is used to evaluate the occlusal arch curve of Wilson and Spee. The vacuum form of the denture will insert addition silicone beauty in the palate. The vacuum form is position relative for the occlusal and incisal edge position. The addition silicone beauty is allowed to set against the palate and helps position to the vacuum form. In the first figure, we notice the vacuum form with set addition silicone on the palatal position for occlusion and aesthetic. In the later, the impression is made with the vacuum form as a customized impression tray. راح نستخدمها كspecial tray along with the bite restoration. The impression within the customized impression tray اللي هو vacuum form allowed to the laboratory to pour and mount the arch at the occlusal vertical dimension of the patient. The bite registration on the vacuum form permit to laboratory to mount the cast to the mandible. In the first figure, we noted a polygauge cone fin The adequate room above the abutment exists for the occlusal material. Second, custom tray vacuum form with beauty in the palette to maintain the occlusal dimension. يعني راح استخدم واحدة ثانية الفاكيوم فورم وبنفس المادة اللي هي بيوتي سيليكون وبنفس الموقع in the palette حتى أحافظ على occlusal dimension. الأكريليك is placed in the vacuum form and positioned over the abutment. مثل ما نشوف مستخدمين اللايت كيور أكريليك. The vacuum form is positioned for occlusion and incisal edge position with the acrylic. من بعد ما صار الأكريليك set and is modified in the laboratory, the teeth are divided with the sandpaper disc. The picture of the initial trimmed acrylic transition restoration. The occlusion is evaluated on the transition restoration. The final impression is made of abutment using light body polyether. The stock tray with regular body polyether is seated over the abutment. The final impression is evaluated. Another impression with alginate is made of the abutment and pour it quick stone to get stone model. After taking the stone model, now we use it to make light cure base plate. The base plate engage only the top of each abutment. Stick wax is applied to the base plate to ensure the wax pattern or wax rim attached to the base plate. After wax rim is added to the base plate and wax rim is placed in the patient mouth. The wax rim is modified in relation to the labial lip support. The incisal edge of the maxillary anterior teeth is determined with the wax rim. The complete wax rim for the anterior teeth and occlusal vertical dimension is recorded. The midline of restoration is determined using dental floss. To evaluate the midline of the face, the high lip line during the smiling is determined. The height of the lip translation corresponds to the height of the tooth, which determines the width of the tooth. The outer width of the nose often corresponds to the midline canine position. The bite registration material is placed on the tissue surface of the base plate after adhesive is painted over the abutment locations. The bite registration material is placed over the wax rim. The occlusal vertical dimension and centric bite are recorded on the base plate and wax rim. The shade of soft tissue derived is made along with the shade of the teeth. The shape of the teeth is also selected. After phase 4 registration of the maxillary arch is made, the transition registration is cemented with non-eugenol temporary cement. I now finishing my part of the seminar. I wish to complete it with my friends with this end of seminar. Thank you very much.